Student, today I am going to explain about HIV/AIDS. Our today's topic is HIV/AIDS. This is also the social problems. Understand? Let's start. AIDS means acute immunodeficiency syndrome. Understand? AIDS means acute immunodeficiency syndrome. A fatal disease. Fatal means causing death. A fatal disease caused by retrovirus known as human immunodeficiency virus. The virus name is human deficiency virus, HIV, which break down the body's immune system. That means the HIV virus, HIV affected or break down the human body's immune system. Understand? Each affected or break down the human body's immune system. Now, causes of HIV/AIDS. The AIDS is caused due to specific virus. Understand? The AIDS is caused due to specific virus known as human immunodeficiency virus. The predisposing factors of AIDS are multiple sex partners, heterosexual means attracted by opposite sex, unsafe sexual encounters, presence of sores in genital area, it's called STDs. Adults between age of 25 to 44 years are at high risk. Understand? At high risk for to lead this disease. Intravenous drug users. Intravenous drug users means injects drugs by syringe in between own vein. Understand? Injects drugs by syringe in between own vein. This is called intravenous drug users. This is the some factors or causes of AIDS. Mode of transmission. The mode of transmission of HIV virus is transmitted by 5 major routes. It's transmitted by one to another by 5 major routes. They are, point number 1, sexual contact. This is the main or major factor of AIDS. Understand? The first and foremost transmission is through sex. Vaginal or oral sex can spread AIDS. Risk will be affected by many factors like presence of STDs type, sexual act and stage of illness of the infected partner. Understand? Women are more prone for HIV because larger surface is exposed and semen contains high concentration of HIV than vaginal or cervical fluids. Understand? This is some sexual contact. Understand? Now, blood and blood products. Sometimes AIDS will be transmitted to another person, one person to another person by blood and blood products. Understand? AIDS is transmitted through the transmission of contaminated bloods and blood products. Understand? Such as platelets, clotting factors, plasma. These all are blood related. These all are the some products of blood. The risk of HIV infection through transmission of 1 unit of blood is estimated over 95%. Understand? The risk of HIV infection through transmission of 1 unit of blood is estimated over 95%. Understand? This is the some transmitted process of AIDS. Point number C. Transplacental and perinatal transmission. That means HIV can transmit from an infected mother to her fetus through placenta or the infant during delivery and by breastfeeding. Understand? disease transmitted by delivery or breastfeeding from his mother's to his own child. The risk is highly in case of newly infected mother or those who already developed AIDS. Understand? Now point number D, contaminated needles. Contaminated needles means needles sharing in the practice of intravenous drug users, understand, by one needle shared by multiple individual, understand. Transmission, this is also the transmission process of AIDS. Transmission through the contaminated needles or syringe or any other skin piercing instruments are less compared to the sexual transmission and through blood transmission. In case of drug users who inject cocaine or heroin, someone inject cocaine or heroin, they are drug users. Chance of transmission is more because of frequent exposure, understand. Now these are the some transmission process of AIDS from one person to another one. Now prevention and control of HIV/AIDS. How we prevent HIV or AIDS. HIV/AIDS is not merely a medical problem. The manner in which virus is impacting upon society reveals the intricate way in which social, economic, cultural, political, and legal factors act together to make certain sections of society more vulnerable. The basic approachable for the prevention of HIV/AIDS include the following. The basic approach how we prevent HIV/AIDS are including following. Point number 1 is education. Educate public. Government have to educate public to avoid unsafe sex and avoid sharing razors and toothbrushes. Government or some medical workers also have to educate public to avoid unsafe sex and avoid sharing razors and toothbrushes. Educate intravenous drug users to avoid sharing needles and syringes to prevent the risk. Educate the HIV positive women to avoid pregnancy, understand. Also educate the HIV positive women to avoid pregnancy since the infection can be transmitted to the unborn or newborn, understand. Prevention of blood-borne HIV transmission, understand. Blood donation can save the life of many people, but those who are donating their blood should undergo tests specifically for HIV/AIDS, understand, so that the blood-borne HIV transmission can be prevented, understand. Who donate his blood, he should be test his blood, understand, before donating his blood. Not only before the blood donation of organs, sperm or any other tissue, the donor should be screened for HIV. Separate syringes and needles should be used as far as possible. This is some prevention to control AIDS. Education HIV infected people. The education of HIV infected people include the following. This is the some education who infected by HIV. Education about family planning methods. Educate the partners regarding the family planning methods to prevent transmission through sex. Educate them about use of condom during sexual intercourse, understand. Educate or refer the patients to the resources like National AIDS Hotline and AIDS Action Council. Educate the patient regarding the National AIDS Hotline or AIDS Action Council. Enumerate them, they can get the help from the sources in order to understand more about HIV/AIDS. its transmission and prevention. If someone requires counseling, they can get it from these resources. Support system for AIDS patients. Some support system for AIDS patients. Most of the AIDS patients are rejected by the family. Understand? This is true fact. Most of the AIDS patients are rejected by the family, neighbors, friends, and colleagues due to fear. The family and community are playing a role in the form of support system. Understand? Family support. Family can help the patient in many ways, helping them to reduce their fear by loving them or making them feel loved. Understand? This is the main duty of family for AIDS patient. Supporting the client financially as much as possible. Understand? Providing a suitable environment where the patient can talk and discuss freely. Understand? This is the family support for AIDS patient. Point 2. Community support. Friends, neighbors, volunteer organizations, colleagues, religious groups, youth groups, etc. are coming under the community. Understand? These organizations are playing a vital role in the support as given below. Emotional support. Feeling of rejection is the devastating experience for the person with AIDS. The community support can be given by explaining the patient or if the family members reject him. Understand? Now, economic support. Presence of chronic illness, loss of job, and high expense treatment will lead to financial crisis in the patient's family. The community can support the client effectively by providing financial assistance, by giving job opportunity, and by providing concession for treatment. These all are the some support system for AIDS patient.